Surgical aortic valve replacement is associated with a very high chance of morbidity and even mortality. It has been estimated in the medical literature that there is a 10% mortality when people are operated between the age of 60 and 70. This mortality beyond 70 up to 80 years rises to almost 20%, which means one patient out of 5 operated for aortic valve surgery will be dead within 3 years. In fact, after the age of 80 years, the mortality rises phenomenally and it is almost to the tune of 34%, which means one patient out of 3 will die by the end of 3 years if operated upon the aortic valve surgically. Now, when the person is operated for aortic valve replacement, there are multiple steps which involve, number 1, cutting open of the chest and cutting one of the most sturdy and the strong bones of the body, which is called the sternum. Second step, it involves putting the patient's circulation on cardiopulmonary bypass because the heart must be opened and it is truly an open heart surgery. But to maintain the circulation is put on cardiopulmonary bypass, which itself has a lot of hazardous effects on the body and especially in people who are elderly. Third thing, a need for a blood transfusion because the blood transfusion must be given after a surgical aortic valve replacement, which itself has multiple hazards. Fourth, there is a need for anesthesia, which itself can have complications. And number 5, a need for ventilator. Ventilation itself is associated with significant complications and therefore at every step there is a complication associated with surgical aortic valve replacement.